Heart disease remains a formidable global health challenge, claiming millions of lives each year. The complexity of the human heart, with its intricate network of chambers, valves, and electrical pathways, demands increasingly sophisticated diagnostic and treatment approaches. In recent years, artificial intelligence, or AI, has emerged as a transformative force in cardiology, promising to revolutionize the way we understand, diagnose, and treat heart disease. AI, with its ability to analyze vast amounts of data and identify patterns that elude the human eye, offers unprecedented opportunities to improve heart health outcomes. From enhancing the accuracy of diagnoses to predicting future cardiac events and personalizing treatment plans, AI is poised to reshape the landscape of cardiovascular medicine. This new era of AI-powered cardiology brings hope for earlier detection, more effective interventions, and ultimately, a future where heart disease is no longer the leading cause of death worldwide. The electrocardiogram, or ECG, a cornerstone of cardiology, provides a window into the heart's electrical activity. AI algorithms have demonstrated remarkable proficiency in analyzing ECG data, often surpassing the accuracy of human experts in detecting subtle abnormalities. By training AI models on millions of ECG recordings, researchers have developed algorithms capable of identifying a wide range of heart conditions, including atrial fibrillation, heart attacks, and even rare electrical disorders that can be challenging to diagnose. One notable example is the use of AI in detecting atrial fibrillation, a common heart rhythm disorder that increases the risk of stroke. AI algorithms have proven highly effective in identifying the irregular heartbeats characteristic of atrial fibrillation, even in patients who may not experience noticeable symptoms. This early detection is crucial, as it allows for timely intervention with medications or devices to reduce the risk of stroke and other complications. Beyond diagnosing existing heart conditions, AI is also transforming our ability to predict future cardiac events. By analyzing a combination of factors, including medical history, lifestyle choices, genetic data, and even information gleaned from wearable sensors, AI algorithms can generate personalized risk scores for heart disease. These risk scores can help identify individuals who may benefit from lifestyle modifications, medication, or closer monitoring to prevent future heart problems. Imagine a future where your smartwatch, equipped with AI-powered sensors, could alert you to subtle changes in your heart rhythm or blood pressure, signaling an increased risk of a heart attack days or even weeks before it occurs. This level of predictive power has the potential to revolutionize preventive cardiology, enabling proactive interventions that could save countless lives. Just as every heart beats differently, every individual responds to treatment in their own unique way. AI is ushering in an era of personalized medicine where treatment plans are tailored to the specific characteristics of each patient. By analyzing a patient's genetic makeup, medical history, lifestyle factors, and even their response to previous treatments, AI algorithms can assist doctors in selecting the most effective medications, procedures, and lifestyle interventions. For example, AI is being used to optimize the dosage of blood thinners in patients with atrial fibrillation, a delicate balancing act that requires careful consideration of individual risk factors. By analyzing a patient's specific characteristics, AI algorithms can help determine the optimal dose to prevent strokes while minimizing the risk of bleeding complications. AI on your wrist, the rise of wearable heart monitors. The proliferation of wearable technology, from smartwatches to fitness trackers, has created a treasure trove of health data. AI is playing a pivotal role in transforming this data into actionable insights. AI-powered wearable devices can continuously monitor heart rate, rhythm, sleep patterns, activity levels, and even blood pressure, providing a comprehensive view of an individual's cardiovascular health. These devices can detect irregularities that might otherwise go unnoticed, alerting users and their doctors to potential problems early on. For example, some smartwatches now come equipped with ECG functionality, allowing users to record their heart rhythm and share it with their doctor. This real-time monitoring has the potential to empower individuals to take a more proactive role in managing their heart health. The human element navigating ethical considerations in AI-driven healthcare. As AI becomes increasingly integrated into healthcare, it is essential to address the ethical considerations surrounding its use. One primary concern is patient privacy. AI algorithms thrive on data, and ensuring the responsible and ethical use of sensitive patient information is paramount. Robust data security measures, transparent data governance policies, and clear patient consent protocols are crucial for maintaining trust in AI-driven healthcare. Another ethical consideration is the potential for bias in AI algorithms. If AI models are trained on data sets that are not representative of the diverse patient population, they may perpetuate existing healthcare disparities. It is crucial to ensure that AI algorithms are developed and validated using diverse data sets to minimize bias and promote equitable access to quality care. The road ahead, future trends in AI and cardiology. The field of AI in cardiology is rapidly evolving, with new advancements emerging constantly. One exciting area of research is the development of AI-powered imaging technologies that can detect subtle changes in the heart's structure and function that may not be visible to the human eye. These technologies could lead to earlier and more accurate diagnoses of heart conditions, improving treatment outcomes. Another promising avenue is the use of AI to develop personalized virtual assistants for heart health. Imagine having a virtual coach on your smartphone that provides tailored advice on diet, exercise, medication adherence, and stress management, all based on your unique health profile. These virtual assistants could empower individuals to take control of their heart health and make sustainable lifestyle changes. Your Heart Health Toolkit. Practical tips for a healthier life. While AI holds immense promise for transforming heart health, there are many things you can do today to protect your heart and reduce your risk of heart disease. Here are a few practical tips. Embrace a heart-healthy diet. Focus on consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit your intake of saturated and trans fats, cholesterol, sodium, and added sugars. Make exercise a part of your routine. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities at least 2 days a week. Maintain a healthy weight. If you are overweight or obese, losing even a small amount of weight can significantly reduce your risk of heart disease. Asterisk. Quit smoking. Smoking is one of the most significant risk factors for heart disease. Quitting smoking is one of the best things you can do for your heart health. Asterisk. Manage stress. Find healthy ways to manage stress, such as exercise, meditation, yoga, or spending time in nature. Asterisk. Get regular checkups. See your doctor regularly for checkups, even if you feel healthy. Early detection and treatment of high blood pressure, high cholesterol, and other risk factors can prevent heart disease from developing. A symbiotic future, humans and AI working together for better heart health. The future of heart health lies in a collaborative approach where the unique strengths of both humans and AI are harnessed to their full potential. AI is not intended to replace doctors, but rather to augment their capabilities, providing them with powerful tools to enhance diagnosis, treatment, and prevention. Doctors bring to the table their clinical judgment, empathy, and ability to build trusting relationships with patients, while AI offers its unparalleled ability to analyze vast amounts of data and identify patterns that might otherwise be missed. By working together, humans and AI can usher in a new era of cardiovascular medicine, one characterized by earlier detection, more effective interventions, and ultimately, a future where heart disease is no longer the leading cause of death worldwide.